Ladies and gentlemen, it is really getting bad, and most of you are keeping up with the news. In the last 4 days, 10,000 people died of coronavirus in America. And I see that Southern California is locking down. I mean, this thing is just getting absolutely crazy. I have some audio I want you to listen to. This is Ali Velchi from MSNBC interviewing an ICU nurse. Right.
Carol Williams, she's an intensive care nurse at the Rush Copley Medical Center in Aurora, Illinois. At last count, Illinois had registered 770,088 confirmed COVID-19 cases and 13,782 deaths. A few weeks ago, Carol Williams made headlines when she shared a post on Facebook about her unfiltered experience fighting on the COVID front lines. She wrote in part, quote, "Imagine being the nurse crying with your patient when they realize that everything we're doing to help them still may not be enough and death is a real possibility. Imagine being the nurse or doctor holding that same patient's hand and stroking their head weeks later while their ventilator is removed because they haven't improved and their family then says goodbye and I love you over FaceTime while they take their last breath." Joining me is that nurse, Carol Williams, who works at the Rush Copley Medical Center in Aurora, Illinois. Carol, you sort of motivated me to remind people that we're in this together. We will get through it together, but together means doing the right things together. And you wrote a remarkable post in which you contradicted 13 lies that are out there in the public, but they're lies that actually make it to you. There are people who tell you things in the hospital that are contrary to medical science because they've heard it in the political environment.
Yeah, and that's why I wrote that, because I think it's important for people to really listen to real healthcare providers that are caring for these patients on the front lines.
What effect does it have on you when you are treating people who you know are very ill, who might die, and yet who are still resistant to the idea that this is a real thing, this is serious, this is a potentially fatal infection?
It's unfortunate for those patients that even when they make it to an ICU that they're not believing in the virus or what's really happening. But the fact of the matter is whether you believe it or not, you are a patient in the ICU now or in the hospital needing very intensive care. So the belief of it's real or a hoax becomes irrelevant because the effects on your body are really taking place, and there's a real possibility that you could die from this virus and the complications that it causes to you.
And you have asked people in your post to imagine what it's like being that nurse. I just read a piece of that. You've asked them to imagine being the COVID ICU patient, the breathlessness, the pain, the fear, the loneliness, the isolation, the anxiety, the hopelessness, and the sadness, the need to use all your energy just to breathe, the true realization that you may not be getting better and facing your own mortality. The truth is that this post you put in could be is more valid now than it would have been 6 months ago when we thought we were at the height of this. You in Illinois, like us in New York, saw the first wave of this thing in April and May. We didn't think we'd be here in December.
We didn't think that we would be facing the same challenges in December that we were facing in the spring, with the disbelief and just the unwillingness to come together for the greater good. So we didn't think that was going to be an issue here going into the winter months, and yet here we are, and things are worse, much worse across the country in hospitals and ICUs, and everybody is stretched, and it's a day-to-day battle with these patients, COVID and non-COVID, with where everybody is going to go.
We're 9 months into this. We may have 6 or 7 months to go before everybody is vaccinated. How are you going to manage through this? Because you did put in your post, and every nurse and doctor we've talked to has said the same thing. We're human. This is hard. You're used to hard. You trained for hard. This is hard at a different level.
This is a level that no healthcare provider in this country has experienced until now. So we are going to lean on each other, lean on our coworkers, because that's who is really understanding what is going on with these patients, and just the amount of burden for the patient, for the healthcare worker, for the system. So we are all leaning on each other.
Carol, I hope you can lean on some of us. I hope the public continues to remember the work that you all are doing. I did like in the early months of this when every day people around this country would open their windows and clap for people like you and frontline workers and the people who delivered our goods, just to remind you that we are grateful. We really are grateful for the work that you are doing, and you will be remembered well. Carol Williams is an intensive care nurse at the Rush Copley Medical Center in Aurora, Illinois. We thank you.
Hey there, I'm Chris Hayes from MSNBC.
Okay, yeah. Yes, I mean, they're saying that the holiday surge didn't even hit. They're expecting that this coming week. And I was looking at some different articles today, y'all, and they're saying hospitals are already maxed out. They literally cannot take more people. I mean, this is absolutely crazy. Now, I knew it would be worse in the winter than the summer, but wow, this even goes beyond what I thought was going to be a bad situation. It far exceeds that. And you are seeing more and more of the videos crop up online of these nurses telling you what it's like. And it's like nothing that they trained for ever prepared them for something like this. You know, I think America took a lot of things for granted and automatically assumed that nothing bad was going to come here on this land as far as a pandemic. They really believed they were free from getting these type of things. This happens in third world countries. Well, I guess America is now officially a third world country when it comes down to coronavirus. And of course, they're talking about the vaccines. Now, the UK will be giving theirs out for the first time this coming week. So then I'm sure there'll be information coming out from them, but they're still saying by the end of the month, they're going to have the vaccines ready here in the US. So we shall see. It's just a wait and see thing. I don't have any confidence built up in the vaccines. You know, I do feel for a lot of these people working in hospitals because everybody is suffering, you know, even a lot of these people that are in different positions, like your x-ray technicians, your EKG technicians, and even your orderlies. I mean, everybody is overwhelmed. Everybody. In fact, one of my son's friends, his grandfather is an orderly, and he said it's absolutely crazy. So, y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.